started without John Stroger's gavel. All right. The email after that last night. Yeah. All right. Perfect. I'm going to get a whole flood of stuff. All right. Let's call the meeting to order with John Stroger's gavel. For those of you who don't know or don't care, it's too bad. This is one of the things I haven't been able to do for 3 years, right?
Yep.
3 years. So it is my calling the Finance Committee meeting to order. It is my understanding that this is the first committee meeting that we've had in 3 years. So in person, we've had committee meetings, but welcome everyone. There's some board members here who have never been in a committee meeting. There's some board member, what do we have, 3 or 4 year terms? I always forget.
4.
4, yeah. So we didn't quite go any director's full term yet, but so good to see everyone today. So a bunch of changes from last time. Roll call votes are not required for action items anymore. They're only required when we were meeting remotely. So that's one change for folks from last time. Roll call vote is required when going into a closed meeting, and we're not going to have a closed executive session today, or at least we don't anticipate it. We can continue to have a combined motion, so that is one thing that we adopted during the pandemic that we may still use from time to time because we were always able to do it. It just hadn't been our practice, but practices change. So now I'd like to have the secretary please call the roll, because we do have to have an accounting for who's here today.
Director Harrington?
Present.
Director Deere? May be remotely connecting, but I do not see him yet. Director Robinson?
Present.
Director Story?
Present.
Chair Ryder?
Present.
You have a quorum.
Ryder's here. We do, if Director Deere does join, we will make a motion to allow remote participation, which is something we haven't had to do in 3 years. So that will be something that will be a different practice for some of you who joined us during the pandemic. The next item on the agenda is public testimony.
We did not receive any public testimony registrations, nor did we receive any written.
Okay, great. Moving on to the next item would be the April 20th, 2023 Finance Committee meeting minutes. These were approved by the board at the April meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Any corrections, changes that need to be made to the minutes? Any corrections or changes that need to be made to the minutes? Hearing none. Can I just do it the old way?
Yeah.
Okay. We have notes that we crib out. Hearing none, is there a motion to accept the minutes?
So moved.
Motion made. Is there a second? Second. Motion's made and seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Next on the agenda is to go through in our contract procurement items. Our Chief Procurement Officer is here, Charles Jones, and we'll also, I believe, continue with our practice that we adopted recently, where the executive sponsors of the contracts will come up and present with Charles. The first items, number 1 through 4, are for the Cook County Department of Public Health, and joining Charles will be Dr. Lamar Hasbrook.
And he is joining remotely.
All right. We don't need a motion for him, though,
No.
because he's not voting.
That's right.
Right? I'm going to keep it fun for a while here, like the old days.
Dr. Hasbrook?
Yes, I'm
Dr.
here.
Hasbrook, are you
Can
there?
you all hear me? Yes, can you all hear me?
We can.
Just speak loudly,
Okay, great.
clearly, and slowly, because we have a little echoey stuff going on in here.
Yes, I hear it. Okay, so good morning, Chair and Directors. I apologize for not being there in person. Had a bit of a family emergency overnight, so I'm calling in. I do have 4 for you today, and they are all grants and or sub-grantees. The first one is for vendor First Baptist Church, Melrose. They are working with us on our COVID response and recovery grant activities. This is for an increase for $100,000, and they are doing outreach in the affected communities, outreach and sponsoring some events for us related to COVID recovery. Again, that fiscal impact is $100,000. Any questions on that one? Okay. Next one.
Any questions?
Oh, sorry.
Go ahead.
Okay, great. So the next one is a sub-grantee. This is extended increase. Again, this is for the same funding, CDC health equity funding to address COVID recovery. This is a vendor that's helping us actually manage the grantees and with the deliverables and the administration of the grant. It's called Saltimer Solutions. It is an extended increased contract fiscal impact of $156,000. It's going to be increased or extended through May of next year. And again, this is due to a no-cost extension from our grantor, which is CDC. Those no questions there. I'll go to the third one. The third one is an extend and increase. This is South Suburban Pads, Chicago. Again, same grant funding. They are our housing partner in this, addressing folks who have been experiencing some housing insecurity. And again, this is extended through May of 24, fiscal impact of $82,000. And then the last one is a execute contract, and this is CDW. This is a part of a GPO that we have, and it's a vendor called Granicus Gov Delivery, and it is software essentially to replace what we had previously, Constant Contacts, which is a very limited platform. This platform allows us to communicate with folks in the jurisdiction through integrated social media, SMS text messaging, newsletters, and the like. And it facilitates bi-directional communication, drop-down menus, et cetera, for them to get information on various programs, et cetera. And so this is a 4-year contract, and it has a fiscal impact of $170,000. And those are the 4 that I have. Happy to take questions.
Any questions for Dr. Hasbrook on any of the 4 items that he just presented? If not, we're going to move to request number 5, which is Health Plan Services, and up to present is Aaron Galena, our Chief Administrative Officer for Health Plan Services. Aaron, take it away.
Good morning, directors. The item before you is a time-only 1-year extension request. This is for a vendor that provides application assistance services for SSI and SSDI. When members are approved for this, they receive additional income, and the health plan also receives additional revenue because they move to a higher rate cell. Happy to answer any questions.
Any questions? Any questions for Aaron on this one? Hearing none, we're going to move to number 6, ambulatory services. Craig Williams is going to be presenting on behalf of Ileana Mora.
Good morning, Craig Williams. This first one is Calumet City Plumbing. It's an extended increased contract totaling $66,000. The extension is from 7/1/23 through 6/30/24. We originally chose this vendor through an RFP, and the request is to continue the provision of plumbing maintenance and repair services for the ambulatory community health network clinics. And we'll be posting an RFP in Q3 of FY23.
All right. Any questions for Craig on request number 6? Hearing none, we're going to go to request number 7 and 8, which are going to be presented by Dr. Rudy Kamopoli. I got that right. I verified. He told me I got it right.
Yes, it is.
All right. Our medical director at Stroger Hospital.
Good morning. So the first contract is with new basic clinical services for intraoperative neuropsychologic monitoring services. This request is for an extension of a contract with no fiscal impact, and we are asking for a 12-month extension through March 2024. This equipment is used by our neurosurgeons in the operating room.
Any questions for Dr. Kamopoli on request number 7? If not, we'll move on to request number 8.
The next contract is with Cardiovascular Systems, Inc. This is for the provision of catheters and products and supplies. This is a request to execute a contract in the sum of not to exceed $210,000. This equipment is used by our cardiologists in their angioplasties in the cardiac catheterization lab. So we are requesting for a sum not to exceed $210,000 and for a 3-year period extending through November 2026.
Any questions for Dr. Kamopoli on request number 8? Hearing none, thank you, Doctor. We're going to go to request number 9, Clinical and Human Resources, and Valerie Amos, our Chief Human Resources Officer, will be presenting on request number 9.
Good morning. This is Valerie Amos, CHRO. The request before you has been awarded through an RFP process. It's for Providence Health and Services. This is really a provider for recruitment as it relates to physicians. We are in need of additional support from a recruitment perspective to identify and really attract the top talent in the physician realm, particularly in our specialty area. This is for a 3-year contract that totals $3.2 million. Questions?
Any questions for Val on request number 9?
Mr. Chair, I have one question.
Sure.
Will they be on site
all done virtual, their work?
Their work at this moment will be virtual, but we can certainly explore that option for them to work with us on site.
Just adding a little bit of clarity to that. Unlike maybe physician recruiters, this service is going to work more like a headhunter service.
Okay.
And so because it's very specialized, so they will take a series of our positions, and so they'll look for neurosurgeons, cardiothoracic surgeons, and so it'll work more like a traditional executive search. But we're contracting because we have quite a bit of positions that we want to make sure we get targeted and move forward. So it's a little different than Valerie's other recruiters, which I think we wanted just to clarify. The other recruiters for nurses, those are here, and individuals who come in and they're part of our HR team supplementing the traditional HR recruiter. This service is in lining more like most hospitals usually recruit when you have a specialized search for a particular type of position. They use different segments of their team. So it's a larger firm that specializes in physician recruitment that can work with different elements of their teams depending what type of positions we're looking for. And the benefit is they can do it simultaneously. So we can have multiple searches running all at one time.
Thank you.
Thank you.
Any other questions? Hearing none. Okay, thanks, Val. Next up is request number 10, clinical and operations development. It's going to be presented by Craig Williams, our interim chief administrative officer for operations and development, who
I will do it.
you're going to do it. Okay.
Yes, I will do it.
All right.
So, yeah, this last contract for us is a request to extend an already existing contract for the provision of blood glucose meters and strips. This is for the use of our diabetics, both on the inpatient and outpatient services. This will have no physical impact to the institution, and we are requesting a 9-month extension.
All right. Any questions for Dr. Kamapoli? Hearing none, thank you. Sorry, I was following the batting order I got in front of me. Request number 11, equity and inclusion, being presented by Shannon Andrews, our Chief Equity and Inclusion Officer.
Good morning. Thank you. This item in front of you is to extend and increase a contract with Deloitte Consulting, not to exceed the dollar value of $979,992, and extending for a 6-month period, taking us to December 5th of 2023. This extension and increase will allow us to continue the initiative that begun in April of last year to provide optimization and to transform the supply chain management department, in addition to providing support for the day-to-day operations.
All right. Any questions for Shannon? Thank you, Shannon. Hearing none, we're going to move on to request number 12, nursing. Who's presenting on this one?
Yeah, I saw
Good morning.
on the phone, Priyank.
Yes, I'm happy to represent Dr. Peters on this. I received an invite just shortly. Is it okay if I get started?
Yep, go.
Again, I apologize, I'm not in person. I just received the invite.
Dr. Bakshi.
But I'm Priyank Bakshi. I'm from Nursing Administration. Can you all hear me?
Yeah, we can hear you.
Okay, perfect. I don't see our contract on the screen just yet.
Oh, you have to ship to Debbie. You have to, Lord.
And just so the word, Priyank is presenting, being as on vacation. So Priyank is one of our nursing administrators.
Yeah, thank you, Mr. Rocha. So this is our AmeriWater contract that we're looking to extend. This is for endotoxin testing in our Stroger dialysis unit. It is a regulatory requirement. We're looking to extend as well as to add dollars to this contract for $21,900, and the extension is for 12 months as our request. Happy to answer any questions.
Any questions for Priyank? All right, thank you. We're going to move along to request number 13 through 18. Craig, you're already in the chair. So.
And if I may, Chair Ryder, request 13 has been withdrawn. So we'll go to 13.
Okay, we're going to move then to request number 14.
Great. Request number 14 is with ABM. It was originally brought into a 6-month emergency contract. We're asking for an extension to 11/30/23 and an increase to $1,681,800. And ABM provides our EVS management services, both the Stroger and Provident campus. This fiscal year, they really have some strong momentum in some of the services they're bringing to bear for us in the environmental services. And the extension will provide time for us to complete an RFP that we launched in April.
Any questions on this item? Hearing none, we'll move to the next one.
Okay, the next one is an extended increased contract with Lind for $407,422. The revised contract period is 4/1/23 through 3/31/24. And this vendor provides preventive maintenance inspections, repairs to our medical gas systems at both Stroger and Provident hospitals.
All right.
Okay, the next one is Cardinal Health. It's an extended increased contract, not to exceed $50,000 is needed for a 12-month contract period, 8/1/23 through 7/31/24. And this request is for the continued use of Certero 100 milligram tablets for the treatment of multi-drug resistant TB. And we sole source this because they're the only vendor of this particular medication.
All right. Any questions on that one? We'll go to request number 17.
Okay. Marino Architects, doing business as JGMA, is an execute contract totaling $4 million. Contract period is 6/1/23 through 5/31/26, and we select them through an RFQ. Marino will provide architectural and engineering services for CCTPH in order to consolidate and modernize their facilities.
All right. Request number 18.
Interface Engineering, originally was an emergency contract for, excuse me, I'm reading the wrong one, sorry about that. Interface Engineering is an execute contract totaling $300,000. Contract period is 6/1/23 through 5/31/26, and was again selected through an RFQ. And they'll be providing architectural and engineering design and administration for Stroger Hospital upgrade and replacement of our medical gas and osmosis systems. And these systems haven't been updated since the building was originally opened in 2002.
All right. Any questions on either that item or any of the earlier ones that Craig presented on? Hearing none, thank you.
Thank you.
We're going to go to request number 19. Dr. Turner, our Chief Hospital Executive at Provident.
Good morning.
Good morning.
This is a request for an extension of the existing contract with dialysis care centers that currently provides dialysis services for our inpatient service at Provident Hospital. We reestablished this service starting in November this year. This allowed us to retain patients that presented to the ED that required dialysis that we were previously transferring to Stroger, and this, by capturing these patients now, it's allowed us to increase our average daily census, and we plan to include this in an RFP for the dialysis center, our ambulatory dialysis center, so that should try to combine these services with one vendor if possible in the future. Let's see. Are there any questions?
Any questions for Dr. Turner? All right. Hearing none. I'd also like to compliment Dr. Turner on his shoe game. It's very, very consistent with mine. Oh my gosh. When was the last time Andrea Gibson reported to the Finance Committee? Request number 20, Strategic Planning and Implementation. Andrea Gibson, our Chief Strategy Officer.
Good morning, directors. This item is a contract with Kaufman Hall to look at the program and work on pro formas to develop the new Provident, the growth plan at Provident Hospital.
Any questions for Andrea? All right, hearing none. we got to the end of the list there. Is there a motion to, approve, yes, Debbie? Oh, yeah, before we do that, Commissioner Deere has joined us. Is there, a motion to, approve, Commissioner Deere's participation, by remote? Is that how we would phrase it? 'Cause we're, as a voting member. Used to be by phone. Motion's been made. Is there a second? Motion's been made and seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Welcome, Dennis. You can vote and do everything now. You can do all the things as a director.
Thank you so
Next, I
much.
would ask for, Deere is here. Next, I would ask for a motion to approve item 4A, contract procurement items containing request number 1 through 20, with the exception of request number 13, which was withdrawn, subject to completion of review by contract compliance. A motion?
So moved.
Motion's made. Is there a second?
Second.
Motion's been made and seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye. Aye. Opposed? The ayes have it. All right, moving on. We're going to, next move to our, again, to our Chief Procurement Officer, who is going to, present our, MBE, WBE report.
Good morning. Again, Charles Jones, Chief Procurement Officer for CCH. On the screen, you have the metrics for the month of March. Looking at the second column from your right is the month of March. There's 20 contracts that you approved for $8.7 million. Of those 20, 4 of them had contract-specific goals from the Office of Contract Compliance, $2.3 million there. We had one prime that was awarded, one prime MBWE vendor for $888,000. Two subcontractors, $301,000. So 3 of the 4, for approximately 52%, and 1.1 million had MWBE participation. I like to say, unfortunately, for full waivers, we had a full waiver of 1 for $560,000. The contract that we had for service for off-site central storage of medical records and retrieval end up with a full waiver there. So looking all the way to the right, the final column, year to date, 18 contracts with over $80 million had goals. 4 of those were prime, $17.5 million. 10 of those were subprime, $20.7 million. So 14 contracts at roughly approximately $38.3 million, or 48% year to date thus far. And then as you see, there was 4 waivers over this kind of about an average of 1 a month. Next page, Debbie. So here you have the bar chart graph of 52% for March, 48% year to date. Any questions?
All right. Moving on to any questions for Charles on that report? Move to the report of emergency purchases. There's one, I believe, being presented. Charles?
Yes.
All right.
For the month of April, we submitted 1 emergency purchase on April 25th of 23. It was with Optimus Hospitalists and Pediatrics, 6-month contract, $135,000 on behalf of the Department of Pediatrics at Humboldt Park Health, the vendor to provide neonatal in-house 24/7 coverage in the labor, delivery, and nursery units.
All right. Any question for Charles on that report on emergency purchases? Hearing none, I would just like to clarify something that's in the agenda. We are not going over the Q1 reported contracts executed under the authority of the CEO this month. That is something that we would be reporting on in June. It just got on the agenda inadvertently this month. So thank you, Charles.
Thank you.
We're going to go ahead and move to our Chief Financial Officer, Pam Cassara, who will first reporting on, grant award related items.
Good morning, directors. First item before you is the receive and file for the grant awards and renewals. It's a fairly small dollar this month. Half a dozen different grants totaling $404,000. I believe the executive sponsors may still be on or present if there are any specific questions.
Any questions? All right. I would ask for a motion to receive and file item 5A, the grant award related items. Is there a motion?
So moved.
Motion's made. Is there a second?
Second.
Motion's made and seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? You guys have it. All right. We're going to move now to the receive and file transfer of funds.
Yes, thank you. Next item before you is a receive and file transfer request of $48.8 million. You can see down the left side there, we are transferring funds from various accounts in the organization, primarily salary surplus, and the to side to registry and professional services for the same dollar amounts across the organization. This is to continue to provide agency and contract staffing as needed while HR actively recruits for those positions.
So it's surplus insofar as that we're still filling those positions, so we're just reallocating until we get the positions filled.
Correct.
Any questions on that item? Hearing none, is there a motion to receive and file item 5B, transfer of funds?
So moved.
Motion's made. Is there a second?
Second.
Motion's made and seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Nay? You guys have it. All right. Report of the fiscal year 2023 financials.
Thank you. So through the 4 months ended March 31, CCH ended $154 million favorable variance on an accrual basis. And also on a cash basis, the county has us at $22.0 million favorable. A couple key items to note, the revenue drivers, very favorable net patient service revenue due to some higher than budgeted inpatient volumes, higher than budgeted directed payments, and receipt of prior year cost report settlements, as well as Medicaid retro rate increases. And then on the county care side, favorable capitation revenue variance to budget due to the higher than budgeted county care membership due to the budgeting that the redetermination would begin at the beginning of the year, and it is just starting now. On the expense side, the only variance of note is the county care claims expense is unfavorable to budget, again, due to the higher county care membership. County care is at a $10.6 million favorable variance to budget, and that membership is over 450,000. Next slide, Debbie. So as you look at the actual financials, again, just drawing your attention to the total revenue line, very favorable, $196.4 million favorable due to the reasons I just outlined. And then again, on the expense side, $68.7 million unfavorable. And if you look up there, you can see the largest variance being the medical claims expense. So bottom line, $85.7 million positive. We budgeted to be $68.4 negative, so $154 million positive variance to budget through March. Next slide, Debbie. Looking at the volumes that drive our financial performance, you can see it's Stroger on it, very strong on the inpatient side, almost 30 patients per day each day of that 4 months, higher than budget. Emergency room visits continue to lag behind, but surgeries are basically right at their budget. And then Provident, almost to their budget as well, only 6 patients per day short of their budget as the ICU and ambulance runs were restarted, and we continue to track that. When you look back to last year and the year before, census of 9 and 7, everything is trending in the right direction there on their volume. ER visits are just still a little behind as well. That variance equates to about 10 a day, so as a percent, 13.7%, but about 10 a day. So again, trending in the right direction, and surgeries are over their budget. ACHN, In total, both primary care and specialty care are basically at budget. However, the split is primary care being under and specialty care being quite a bit over, but combined, they are a little bit ahead of their budget. And then, as we mentioned, the county care membership, 451,000, we budgeted to be at 400,000 at this point in the year. Next slide, Denny. These graphs just illustrate the same information over time as we track back to the 2019 pre-pandemic levels and how our volumes are tracking back to that. And as you can see, we are on track in most areas, projecting to actually be at or better than budget. And then payer mix, next slide. Not a lot to report here as of yet. However, again, the Medicaid has continued to trend up and uncompensated has trended down during the pause on redetermination during the pandemic. And now that redetermination has started, we'll watch this to see if there is start to be an increase in the uncompensated and decrease in the Medicaid. However, we have various outreach going on to help people get re-signed. And then the next slide, revenue cycle continues to hit it out of the ballpark, green on most of their indicators. Still cleaning up a claim issue on the discharge not final bill, but other than that, continues to meet most of their benchmarks. And then denials, again, also trending down, which is what we like to see. They're meeting their goal as a percent of cash. And continued improvement on reducing denials in all areas. Next slide. Charitable and public program expenditures also trending to pretty close to prior years, as a percent of revenues and a percent of our costs. But again, we'll continue to watch those top two lines, the traditional charity care and the other uncompensated care, which is the bad debt, to see if those start to increase if people start to fall off the Medicaid roll. Next slide is our savings initiatives in progress. 4/12 of the way through the year, we would have hoped to be at 33%. You can see we're at 22%. There's a few yellows there. However, those items were slated to start a little later in the year, and we do anticipate catching those up as the year goes on. And then lastly, health plan services or county care. The story, again, the graph at the bottom, the blue bars we budgeted for redetermination to begin at the start of the year and slowly go down over the course of the year, but the red bars show us still at the higher membership and continue to pick up a few thousand members each month as well. So they came in, as I mentioned earlier, 9.6 million bottom line. They budgeted $1 million loss, so they're 10.6 million ahead of their budget year to date. Any questions?
Mr. Chairman, I don't have a question. I just have a quick make a comment.
Sure.
On slide 8. Pam, I think it should not go unnoticed, the great work that Curtis and your team members are doing with respect to the net final denials. I mean, that's outstanding. I mean, you're right on top of zero. I mean, I want to encourage you to do better, but I don't know how I could do that and sound reasonable.
Thank you.
Great job.
Yeah, I mean, I believe we were well above 2% when we started this process, so. Any other questions or comments on the year-to-date financials? All right. Thank you, Pam. Well, as a middle-aged Gen Xer, I both am enamored with technology, but also realize its limitations to someone like me when I'm, in the ability to run a meeting. So I am much more comfortable in this format, even though I did appreciate the opportunity to use Teams for the last 3 years. So I just want to thank everyone for joining us here today and getting back to doing meetings like we sort of used to. So with that, we've exhausted the agenda and the meeting's adjourned.
I think we're back in school.
Yeah.
We got to take a picture since this is.
Yeah, I mean, it's pretty wild. It's pretty wild. Get to go back. Does this badge still work for the elevators and all that? Yes.
Okay.
I need a new badge.
Do you want to go do that now?
Sure.
We can do that. We've got-
Are your badges?
Yeah, we got right through this meeting, didn't we?